So what's the difference between a diagnosis and a prognosis? So today I want to tackle this issue. But before I say anything, let me say that you get your diagnosis first before you get your prognosis. So what's a diagnosis? A diagnosis is the discovery process for a doctor to discover the disease that you have. So when you go to the hospital with complaints, the doctor will follow the following steps. First, we'll take history. Second, we'll do examination. And third, we'll do investigations. So the history-taking process is a bit frustrating for the patient because the questions can be many. And also the people asking the questions can be many. Sometimes the nurse, the student nurse, the doctor, the student doctor will ask the same question to the patient's frustration. But don't worry, it's a process of discovering the disease that you have. So the second step is examination, whereby you undergo physical examination. We call it general examination for the whole body and systemic examination for the particular system that ails you. After examination, you go to investigations. Investigations is just tests that are done on your body so that you don't do so many tests. It is guided by what the doctor is already thinking about. During the history taking, what the doctor is thinking about will be registered as an impression. Impression is like a presumptive diagnosis or a placeholder diagnosis. An impression will be accompanied by differential diagnosis. And then finally, the doctor will send you for investigations, radiology, lab tests, psychometric tests if you are a psychiatric patient, maybe special tests like audiogram tests or visual tests, or advanced tests such as radionuclide tests, or genetic tests, e.g. DNA sequencing. The doctor now will narrow down on the diagnosis from what he was thinking, which was the impression, to now a diagnosis. And after confirmation of diagnosis is when now we proceed to treatment. But the doctor could have given emergency treatment or what we call empirical treatment based on what he thought before even the lab work comes back. Why? Because doctors are highly trained, and in most cases, what they initially think is the disease usually ends up being the disease. There are also several different types of diagnoses. So besides the impression, which I already explained, there is also what we call a spot diagnosis. Spot diagnosis is what the doctor can notice immediately while seeing you for the first time, even without examining you. So that's about the diagnosis. So what about the prognosis? The prognosis is simply a probability that the doctor comes up with to tell you or to guide you about the cause of your disease. Like they may tell you that the 5-year survival rate of this disease is 50%. So that is not to say that you'll be dead in 5 years, but to say that 50% of people with this disease will not survive beyond 5 years. So some patients will not take it well if they are told that, and some patients will complain if they end up surviving, saying that my doctor said I'll not survive beyond 5 years, and here I am. So well and good. That's mostly because they don't understand prognosis. So prognosis is not a certainty, it is a probability. Much like the weatherman's prediction. So meaning that if the weatherman says that the chances of rain is 50%, then it means that half of the times it will rain, and the other half of the times it will not rain. So people need to understand prognosis so that they don't blame doctors for predicting doom on them. And the doctor always has the interest of you surviving. Now you know. Thank you.